in these bills, in all the bills, the Senate Health Bill and the 3 House bills and the Blue Dog bills, all say that we will have guaranteed issue. Insurance companies must sell you a plan, which is not the case today. If they think you're going to file some claims, they're not going to cover you. Now, if you have a pre-existing condition, they have to sell you a plan, and they can't charge you more because your health status isn't as good as the person next door. No health status rating. These are enormous changes to the private insurance market and very, very important. There's also no gender rating. Age rating is a bit of an issue out there among friends. We are still looking at where that issue will land. There may be some premium variation based on age, but right now no premium variation on health status. Huge change. And within that package of private market reforms, there is also something called a medical loss ratio, which says that insurance companies now will have to uniformly account for what they do with the premium dollars that come in, and they will have to spend a certain percentage of those premium dollars actually on healthcare services, not on CEO salaries or profits for shareholders. Now, that's not the public plan option. This is in the private plans that will be in competition with the public plan. Probably, depending on what bill, they actually state what that ratio is. But basically, very important, not all states have it, you actually have to say that when we take in premiums, we're going to spend at least 85% of those dollars on healthcare services. Right now, in the private individual market, the market that Peter probably would have to be in, my husband has to be in if he didn't have insurance through my job, 60% is the norm. So 60% of premium dollars that flow in get spent on healthcare services, the 40% are spent on profits and CEO salaries. And that will, under one bill, start kicking in immediately, even before you have the system of new national exchanges. Another important reform that often gets overlooked is no longer will insurance companies be allowed to revoke coverage. And there's been quite a bit of that across the country. You have insurance, you paid for it, you've been responsible, made your premium payments, you get sick, you file a claim, and they start looking back to see, should you have known if you had cancer 5 years ago, and if there's some reason why that headache didn't seem like the migraine you'd had all your life and you should have known it was a tumor, they can revoke your coverage. They will no longer be able to do that. There will be very strict rules about rescission of coverage or revocation of coverage, a huge change. That will also begin immediately in 2010. So sometimes you hear nothing good's going to happen until 2013, not true. There's additional accountability for insurance companies. I mentioned medical loss ratios. There will also be a very strict program of rate review so that every time they want to file a new charge, a new premium, a new rate, they will have to go through a very stringent process of rate review. That does not happen in all states today. So those are all great reasons to support healthcare reform. Let me give you a few more. I mentioned the Medicaid eligibility level that will help the lowest income people, but what happens to people above 133% of poverty? And let's see, 133% of poverty, I should be able to do this off the top of my head, I'm having a blank moment, is about $24,000 for a family of 4. So what happens to folks who make more than $24,000? Family of 4, and it's a little different numbers depending on family size. They get eligibility, they get subsidies, premium subsidies through the exchange. The exchange and the subsidy system will go into place in 2013. As I said, there's some good private market reforms that will kick in before that. The subsidies are based on protecting you from spending more than 1% of your income on health insurance. It's not a percent of premium, but it says depending on what income bracket you're in, you don't have to spend more than X% of your income on health insurance. For the people at 133%, the ones who are moving out of Medicaid eligibility into the exchange, the income protection is 1.5%. You don't have to spend more than 1.5% of your income for your insurance coverage. It slides up to 12% at 400. There's some differences in how it slides up. And it's 12.5% in the health bill, but basically it's of protection of 1.5% to 12% premium subsidies, and that goes up through people who make 400% of poverty, which is about $88,000 for a family of 4. So significant help for hardworking middle-class Americans who are struggling to afford health insurance. The insurance you buy will have caps on how much you have to spend out of pocket. And the caps actually get pretty complicated, and I'm not going to get into it, but the lower income that you are, the closer to 133, the stronger the out-of-pocket protections. So your deductible and your co-pays are limited, and it's not just limited by year, but it's a lifetime. There are lifetime caps, there are annual caps, and there's 2 ways that the bills do that, and it actually makes a lot of people in my office head spin when I talk about it. So I'm not going to do it, Jessica, but if you want to get into it, I'm glad to do that with you. But they are very strong protections, and they are targeted to help those who are lower income the most. Finally, and I mentioned this, there is a subsidy for small businesses. And there's some differences in what small businesses or which small businesses will be eligible. The push right now in Congress is to provide the subsidies to more small business, not less. And we like that at families, and I like it at my household. So that some small businesses will get a 50% small business tax credit to pay for premiums. So 50% of help with 50% of the cost of premiums if you're a small businessman trying to provide it to your workers. Now, I won't say that's all small business. It's certainly not a firm of lawyers making big bucks in downtown DC. But for a small business like my husband's, probably like yours, Peter, there will be some small business tax credits. So I think that's a great thing. Finally, the thing I'll mention that really has been below the radar screen, and I haven't gone through all 10 reasons why I'm excited about healthcare reform. I'm on 7, and I'm going to stop there, is that it is very likely, and we don't know the details, there's several variations on this theme in the bills I described, that the health reform will actually either close the donut hole in the Medicare Part D program, where seniors must pay for prescription drugs themselves, either close it over time, not overnight, or give significant help to seniors in the donut hole. And there's variations on this in the 3 bills, they're all different. But one thing I am pretty confident of is that the members of Congress know their politics, and we're going to see a significant amelioration of the donut hole Medicare Part D. Does everyone know what the donut hole Medicare Part D is? I mean, it's that above us, you get help with prescription drugs, and I can't think of the dollar amount right now off the top of my head, but wait, I have a cheat sheet. It's very handy, it's all back there, you all can read it to me. I can never do this off the top of my head. I bet there's a senior in here that knows it. In 2009, reading from my hymnal here that you all have on the back seat, the gap in Medicare Part D prescription drug coverage, the so-called donut hole, begins after beneficiaries incur a total of $2,700 in drug costs. Coverage does not resume, so you must pay for all of your drugs out of pocket once you've gotten to that $2,700. Folks, I spend that on drugs every year, and I'm not very sick. I have a few problems. Coverage does not resume until they spend a total of $6,154. So during that period, seniors have to pay for their prescription drugs out of pocket. And the healthcare reform will either eliminate that or significantly help seniors with the cost of drugs in that gap. There's some variations on it again. So this is a huge change for seniors and seniors with prescription drug costs. In addition, there'll be some other changes to the Medicare program, and contrary to what you hear from those who oppose health care reform, there is nothing that will require seniors to be euthanized. Let us be clear that the only thing that is being talked about there, frankly, is a provision that will provide funding for counseling on the benefits of living wills, and in a living will, you can spell out that you never want to have any life support ever